If your doctor has never talked to you about this, you are not alone. There is a connection between your blood pressure and your intimate life after 60 that most physicians simply skip over during appointments. And the truth is, ignoring this connection could be quietly affecting your relationship, your confidence, and your overall happiness every single day. Stay until the end, because what I am going to share with you today could genuinely change your life. Welcome back to Senior Health Secrets Over 60. I am Dr. Jessica Reed. If you are new here, this channel is dedicated to giving you the honest, practical health information you deserve. Hit that subscribe button and tap the bell so you never miss a video. Today, we are going to talk about something deeply important, something that affects millions of seniors, but almost nobody discusses openly. Let me ask you something. Have you noticed changes in your intimate life since turning 60? Maybe your energy is lower. Maybe your relationship has quietly shifted in ways you cannot quite explain. You are not imagining it, and it is not just age. According to the NIH, nearly 75% of adults over 60 experience some form of decline in their intimate health. And here's what most people do not realize. High blood pressure is one of the biggest hidden reasons why. This is not just a heart problem. This affects your entire quality of life, your relationships, your confidence, your joy, and you deserve to know the full picture. I have been practicing medicine for over 15 years. I have worked with thousands of patients over 60, and I can tell you honestly that this topic comes up constantly in my exam room. Patients feel embarrassed to bring it up, and sadly, many doctors rush past it. But here's what most doctors will never tell you. Blood pressure and intimacy are deeply connected, and managing one can dramatically improve the other. So let's get into it. I am going to walk you through 7 things you absolutely need to know. The first thing is this. High blood pressure directly reduces blood flow throughout your entire body, and your intimate health depends entirely on healthy blood flow. When your arteries are under too much pressure for too long, they begin to stiffen and narrow. This happens gradually. You cannot feel it happening, but the effects show up in ways that confuse and frustrate people. For men over 60, reduced blood flow is one of the leading causes of intimacy difficulties. For women, it can cause reduced sensation and discomfort. According to the American Heart Association, men with high blood pressure are twice as likely to experience these challenges compared to men with healthy blood pressure. Margaret, one of my patients, came to me completely puzzled. She said her husband had changed. He seemed withdrawn and frustrated. When we looked at his blood pressure numbers, once we addressed his blood pressure, things in their relationship began to improve significantly. The practical tip here is simple. Get your blood pressure checked regularly. Know your numbers. A reading consistently above 130/80 needs attention. Do not wait. But that is just the beginning of what I need to share with you. Because the second thing I am about to tell you surprises almost every single patient who sits across from me. The second thing you need to know is that some blood pressure medications can actually make intimacy problems worse. This is the conversation most doctors never have with their patients. Certain medications used to treat high blood pressure, especially older types called beta blockers and diuretics, are known to affect intimate function in both men and women. According to the NIH, this is a well-documented side effect that affects a significant number of patients. Robert, one of my longtime patients, had been on blood pressure medication for 3 years. He assumed his intimacy difficulties were simply part of aging. Nobody had ever connected the two for him. When we reviewed his medications together and made an adjustment with his doctor, he could not believe the difference. The tip here is this. If you are on blood pressure medication and have noticed changes in your intimate life, please talk to your doctor. Do not just accept it. There are many different types of medications. Some have far fewer of these effects. You have options. And speaking of options, what I am going to share next is something that can help your blood pressure and your intimate health at the same time. The third thing is one that genuinely excites me to share. Certain foods have been proven to improve both blood pressure and intimate health simultaneously. This is not a coincidence. Foods that support healthy blood vessels benefit every system in your body. Leafy greens like spinach and kale are packed with nitrates. Your body converts these into nitric oxide. Nitric oxide relaxes and widens blood vessels. This improves blood flow everywhere. Beets and beet juice work the same way. Studies cited by the American Heart Association show that regular beet juice consumption can lower systolic blood pressure by up to 8 points. Dark chocolate with 70% or higher cocoa content contains flavonols that support blood vessel health. Even watermelon contains an amino acid called citrulline that promotes healthy circulation. Dorothy, one of my patients, started adding spinach to her morning smoothie and eating a small piece of dark chocolate each afternoon. Within 8 weeks, her blood pressure had dropped noticeably, and she reported feeling more energetic and connected with her husband. Start with one of these foods this week. Small changes create big results over time. But food is only part of the picture, because number 4 is something that happens while you sleep, and most seniors have absolutely no idea it is going on. The fourth thing is sleep apnea. This is one of the most underdiagnosed conditions in seniors over 60, and it directly damages both your blood pressure and your intimate health. Sleep apnea causes you to stop breathing repeatedly during sleep. Each time this happens, your body releases stress hormones. These hormones raise your blood pressure. They also drain your energy and your hormonal balance. According to the NIH, untreated sleep apnea is associated with significantly higher rates of intimacy difficulties in both men and women. The connection is real, and it is serious. James, one of my patients, came to me exhausted every morning. His blood pressure was stubbornly high, despite medication. His wife mentioned he snored heavily. We referred him for a sleep study and discovered severe sleep apnea. Once he began treatment, his blood pressure improved and his energy returned. He told me it felt like getting 10 years of his life back. If you snore loudly, wake up tired, or feel exhausted despite sleeping enough hours, please bring this up with your doctor. A simple sleep study could change everything for you. And now, before I continue, I want to ask you something. Before I continue, if this is helping you, please take 2 seconds and hit that like button. It helps me reach more seniors who desperately need this information. And if you have a parent or friend over 60, please share this video right now. It could make a real difference in their life. Now, the fifth thing. This one is about stress, and it is more powerful than most people realize. Chronic stress raises your blood pressure, but what they do not know is how deeply stress suppresses the hormones responsible for intimacy and connection. When your body is flooded with cortisol, the stress hormone, it signals that survival is the priority. Everything else, including your intimate health, gets pushed aside. According to the AHA, chronic stress is a significant and underappreciated risk factor for high blood pressure in adults over 60. Patricia, one of my patients, was caring for her sick husband while managing her own health. Her blood pressure was dangerously elevated. She felt completely disconnected from herself and from any sense of joy. We worked together on simple daily stress reduction practices, gentle breathing exercises, short walks outside, 10 minutes of quiet each morning. Within weeks, her numbers began improving. She told me she felt human again. The tip is this: stress management is not a luxury, it is medicine. Start with just 5 minutes of deep breathing each day. Breathe in for 4 counts. Hold for 4. Out for 4. Do this twice a day. It costs nothing, and the benefits are real. But what I am about to share next is something that most seniors feel too embarrassed to bring up with anyone, including their own doctor. The sixth thing is this: hormonal changes after 60 affect both blood pressure and intimate health in ways that are deeply connected. For women, the drop in estrogen after menopause causes blood vessels to become less flexible. This contributes to rising blood pressure. It also causes physical changes that affect intimacy directly. For men, declining testosterone affects both cardiovascular health and intimate function. According to the NIH, hormonal shifts after 60 are a significant and often overlooked factor in both high blood pressure and intimacy challenges. Carol, one of my patients, was frustrated and confused. She was eating well, exercising, and still her blood pressure was rising and her intimate life had changed dramatically. When we looked at her hormone levels, the picture became clear. Working with her doctor on a careful, appropriate plan made a meaningful difference. The tip here is to ask your doctor to check your hormone levels at your next appointment. This is a simple blood test, but the information it gives you is powerful. Do not be embarrassed to bring it up. You deserve complete care. And now I want to share the seventh and final point. This one ties everything together, and it is perhaps the most important thing I will say today. The seventh thing is this: exercise is the single most powerful natural tool you have for improving both blood pressure and intimate health after 60. This is not my opinion. This is what the research consistently shows. According to the American Heart Association, regular moderate exercise can lower systolic blood pressure by 5 to 8 points. It also improves circulation, boosts mood-enhancing hormones, increases energy. You do not need to run marathons. A 30-minute walk 5 days a week is enough to create measurable changes. George, one of my patients, was 68 years old and felt like his best years were behind him. His blood pressure was high and his confidence was low. I encouraged him to start with just 20-minute walks each morning. 3 months later, he came back for his checkup smiling. His blood pressure had dropped significantly. He said he felt more alive than he had in years. Start walking. Start today. Even 15 minutes counts. Your body will respond. Here is exactly what you need to do starting today. First, get your blood pressure checked this week if you haven't done so recently. Know your numbers. Second, if you are on blood pressure medication, schedule a conversation with your doctor specifically about side effects related to intimacy. Come prepared with questions. Third, add 1 blood flow supporting food to your diet this week: spinach, beets, dark chocolate, or watermelon. Fourth, if you snore heavily or wake up exhausted, ask your doctor about a sleep study. Fifth, begin a simple stress reduction practice today: 5 minutes of deep breathing morning and evening. Sixth, start a daily 20 to 30-minute walk. Put it on your calendar like an appointment. These 6 steps are simple, they are free or low cost, and they work. Let me quickly bring together everything we covered today. High blood pressure reduces blood flow and directly affects intimate health. Some blood pressure medications can make things worse, and your doctor should know if this is happening to you. Certain foods support both blood pressure and circulation simultaneously. Sleep apnea is a hidden cause that goes undetected in millions of seniors. Chronic stress suppresses both cardiovascular and intimate health. Hormonal changes after 60 are real and treatable, and exercise is the most powerful natural medicine available to you. I want you to hear this. You are not too old. It is not too late. The changes you have noticed are not permanent. With the right information and the right steps, you can feel better. Your relationship can be stronger. Your confidence can return. I see it happen with my patients all the time, and it can happen for you too. I would love to hear from you in the comments below. Has your doctor ever talked to you about the connection between blood pressure and your internet health? Let me know. Your comment might help someone else feel less alone today. If this video helped you, please give it a thumbs up and subscribe to this channel. Every week, I bring you honest, practical health information designed specifically for adults over 60. Share this video with someone you care about. They may need to hear this more than you know. In my next video, I am going to cover the 5 most dangerous medications that seniors over 60 should ask their doctor about immediately. You do not want to miss that one. I am Dr. Jessica Reed, and I will see you in the next video. The information in this video is for educational purposes only and is not intended as medical advice. Always consult your doctor before making any changes to your health routine.